Hello everyone, welcome to another module on the renal system. In this module, we will talk about kidney stones or nephrolithiasis. Okay, so what is kidney stones? It is the precipitation of urinary solute precipitated in stones in the urinary tract. Is it clear? The risk factors includes high concentration of certain substances and low urine output. It can lead to severe complications such as hydronephrosis, pyelonephritis and acute kidney injury. An obstructed stone will present with flank tenderness, colicky pain radiating to the groin and hematuria. Now what is colicky pain? This pain comes in waves and is very severe. Okay. So the treatment and prevention is by excessive fluid intake so that the stone is removed. So let's talk about the first type of stone and the most important type of the stone, that is calcium stones. Calcium stones are precipitated because of excessive calcium oxalate and hypocitruria. Okay, so first of all, remember that calcium stones occur when there is an increase in hypercalciuria. That means there is an increase in calcium levels in the urine, but it is nowhere relevant to say that calcium stones are due to hypercalcemia. That means there is a normal serum calcium level. Always remember there is a normal serum calcium level. This is very important. There is only an increase in the calcium in urine. Okay. In the X-ray, we see calcium stone as radio opaque substances, and same is in the CT scan. Now, what is the shape of calcium stones? These are shaped in envelope. You can look at this. These are envelope shaped stones or dumbbell shaped stones. These are dumbbell shaped or envelope shaped. Is it clear? The calcium stones are the most common, as I told you. That is, the 80% of the stones are usually calcium stones, and calcium oxalate stones are more common than calcium phosphate stones. The calcium phosphate stones have a shape of wedge shape or prism shape. Now, calcium oxalate stones are a result of ingestion of ethylene glycol or vitamin C abuse or hypocysturia. This is usually associated with decrease in the urine pH. That means the pH in the urine is less, whereas in calcium phosphate there is an increase in the pH. This can also occur due to malabsorption, which is in Crohn's disease. The Crohn's disease I have explained in GI module, that is a gastroenterology module, with ulcerative colitis. Okay. So basically the causes of calcium oxalate are ethylene glycol ingestion, vitamin C abuse, hypocysturia and malabsorption. So what are the treatments of calcium stone? May it be calcium oxalate or calcium phosphate. The primary treatment is usage of thiazides. There should be low sodium diet, and if there is calcium oxalate stone, there should be intake of more citrate. So this hypocysturia is cured. Is it clear? Now let us talk about the second type of stone, which is the ammonium magnesium phosphate stone. Ammonium magnesium phosphate stone, which is also called as the struvite stone. This occurs with increase in the pH and is radio opaque in X-ray and CT fine. You can look in this structure. It is radio opaque. This is the struvite stone. It is usually a coffin lid shaped stone. You can look at this diagram. This is a coffin shaped. It accounts for around about 15% of the stone. That is the second most common type of stone after calcium stones, and it is caused by urease positive organisms. Now, what are urease positive organisms? Organisms which convert urea to ammonia are urease positive organisms. Example: Protease mirabilis, Staphylococcus saprophyticus, and Klebsiella. This results in urine alkalization. Due to increased quantity of ammonia, it leads to urine alkalization, and hence the pH also increases. This results in common form of stone, which is the staghorn calculi. You can look at this. This is a staghorn calculi. This looks like a staghorn calculi. Now, what is the treatment of ammonium magnesium phosphate stone? It is the eradication of the underlying infections. Okay, it is the eradication of these underlying infections by use of antibiotics or the surgical removal of the stone. If the stone is big in size, we have to surgically remove it. Remember that ammonium magnesium phosphate stones are related to urease positive organisms like Protease mirabilis, Staphylococcus saprophyticus, and Klebsiella. Are you clear with the ammonium magnesium phosphate stone or the struvite stone? Now let's talk about the third type of stone, which is the uric acid stone. Now, since it is the precipitation of uric acid, there will be decrease in the pH. Since it is an acid, it is radiolucent. Remember, if you see a radiolucent stone in a CT or an X-ray, which is minimally visible, it is uric acid stone. What is the shape of this stone? This is a rhomboid shaped stone. This is a rhombus or a rosette shaped stone. This is the third most important and the third most common type of stone, which occurs in 5% of the patients. And the risk factors include decrease in the urine output or arid climates. If any question presents with a demography of arid climate, then it relates to uric acid stone. It is majorly associated with decrease in the pH, that means acidic pH, and has a very strong association with hyperuricemia, which occurs in gout. Correct? Now, it is often seen with myoproliferative diseases, that means increased cell turnover. Example, leukemia. So, when there is myoproliferative cell disorders, this leads to uric acid stones. So, is it clear? Now, what is the treatment of uric acid stone? It involves majorly hydration and alkalization of urine. Now, how is that? That can be by potassium bicarbonate. It can take place by potassium bicarbonate, or if the person has gout, gout is treated by allopurinol. So, if we cure gout, these uric acid stone also resolves. So, are these three type of stones very clear? Now, let us go to the last section, which is the cystine stones. Okay, this is also associated with acidic pH, hence there is a decrease in the pH, which leads to precipitation of cystine stones. In X-rays, it is fairly radio opaque, whereas in CT scan, it is moderately radio opaque. Is it clear? This is a very rare cause of nephrolithiasis and is most commonly seen in children. Okay. Now, the shape of the stone is majorly hexagonal. We can see it in this diagram. Okay, this is hexagonal shaped stone, and it is a hereditary condition, that is an autosomal recessive condition, which leads to ineffective cystine reabsorption by the PCD. So, the PCD, that is the proximal convoluted tubule, is not able to absorb cystine properly due to a autosomal recessive disorder causing cystinuria. Okay, this also results in staghorn calculi. The transporter defect results in poor reabsorption of various other substances as well, that is ornithine, lysine, and arginine. So you remember it by C for cysteine, O for ornithine, L for lysine, and A for arginine, hence cola. Cysteine is poorly soluble and thus forms stone. Okay, so if there is any defect in reabsorption of cysteine, it can majorly result in cystine stones. Now, it is usually in childhood, as I said, and can form staghorn calculi. So, you know where else the staghorn calculi is present? I'll take you back. Yes, it is the ammonium magnesium phosphate where staghorn calculi is present. Okay. Now, there is a sodium cyanide and nitroprusside test which comes positive due to cysteine in the blood, and hence these have 6 sides. We can remember as cysteine, 6 sides. And what is the treatment of cystine stones? It is majorly alkalization of the stones due to decreased pH. We have to alkylate it and make it more pH. We can use low sodium diet, which also helps in increasing the pH. We can also use chelating agents like penicillamine if it is a refractory. Okay, so is the cystine stone clear? It is majorly due to a hereditary defect which increases the amount of cysteine, resulting in formation of staghorn calculi detected by sodium cyanide and nitroprusside test, treated by low sodium diet, alkalization and chelating agents. So, are the 4 types of stones clear? This is all about nephrolithiasis. Thank you for watching this video. If you enjoyed the video, please click on the like button and do subscribe to this channel. Let me know in the comment section below which topics do you want me to explain. Thank you.